Welcome to Straight Outta Health IT. Getting into health tech is rough, but here's an unfiltered dialogue of healthcare leaders and influencers covering a wide variety of issues affecting healthcare and the health tech industry. And now your host, Christopher Cunny.
Hello, everyone. This is Christopher Cunny, and welcome back to another episode of Straight Outta Health IT. I'm so happy to have you back and listening in on this week's segment. Today, we're going to talk about navigating the new norm, really unpacking the current state of mental health post-COVID-19. For those of you who may not be aware, 23 marks the third anniversary that the world literally stood still and everyone on the planet was coming to grips with this once in a 100-year catastrophic event. COVID-19 has brought many changes to our daily lives. One of those most significant changes is the impact that it's actually had on our mental health. The pandemic has brought about all sorts of feelings around uncertainty and fear and anxiety, and which actually has led to an increase in mental health issues across the United States, probably I would even venture to say all across the world. As we slowly start to transition back into what we consider now our new normal, I think it's important for us to understand, current state of mental health in the United States post COVID-19. And I'm lucky to have on this episode an expert that's going to share her insights around this. Well, I'm hoping that in this program, we can not only just talk about some of the unique challenges that exist now around mental health post the pandemic, but also talk about some of the treatment options that are available to us as well, and how technology is also impacting our ability to provide care and address maybe some of the socioeconomic issues associated with mental health services. Today's guest is not only an advocate, but a subject matter expert on mental health. Let me introduce to my listeners, Ms. Lindsay Demboski, Senior Vice President of Business Development at Integrated Psychiatric Consultants. With a specialized expertise in telepsychiatry, as well as medical, psychiatric, pharmaceutical, and behavioral health practices, Lindsay believes lifelong sustainable relationships are at the core of what she does. Lindsay is a proven leader in business development, recruiting, contract development, process improvement, and quality assurance for medical and behavioral health organizations with a nationwide reach. After graduating cum laude, congratulations, from the University of Georgia, from Athens with a bachelor's degree in science in family consumer science in 2006. And then she completed her internship and graduate studies at Georgia State University. Lindsay has always had a passion for supporting and connecting people. Now, partnering with communities nationwide to provide crucial life-saving care where it might otherwise not be available. And that's what she does actually every day at IPC. She has a passion and a commitment for improving the human condition, and she firmly believes that mental health is a foundation of our well-being. She loves knowing that her role is impacting the lives of people nationwide by connecting patients to mental health services and providing them life-changing support. So join me today in welcoming Ms. Lindsay Demboski to the program. Hi, Lindsay.
Hi, thank you for having me. Really looking forward to sharing some knowledge and getting to know your listeners and educate them on the world of mental health post-COVID-19.
Sounds great. Well, what I like to do at the beginning of every one of my episodes or interviews, I read your bio, which tells us a little bit about your story. But it doesn't really give us complete insight of your journey and what led you to the role that you're in today. So I'm going to ask a very simple layup question. Tell us about that journey, that story, Lindsay's story into mental health services and the role that she's playing today at her organization.
Absolutely. So I think it's important for everyone to have a story in your career and what you're doing and why you're doing it. And I get asked often, what is your story? How did you get involved in mental health? And I think all of us have been touched, whether it's personally or a family member or friend, someone that's, had mental health conditions, whether it be anxiety, depression, someone who unfortunately has been affected by suicide. And so for me, I've dealt with a little bit of postpartum anxiety. I do have a sibling that struggles, but really I'm a mom and I have 2 children that are the future of our country, our world. And I just want to make sure that I'm helping them be impactful and be the change that we need to, one, stop the stigma of mental health and just helping them being kind human beings to everybody.
Wonderful. And I can appreciate your journey. And to your point, I think everyone, in their, whether they're family, friends, or associates, knows someone that's dealing with challenges around mental health. I know personally as well, I've had issues within my own family and most recently, even with my own son, who was dealing with depression as a result of his isolation due to the COVID-19 pandemic as well, too. So this is a very important topic for me, and I'm very interested in hearing your insights around that. But before we jump into that, too, just real quickly, as we were prepping for this episode, you shared something with me, which I thought was really interesting. And we'll have to have you back on. We're going to talk about that. And that was really more around organ transplants.
Yeah.
Transplantation. So share a little bit with our audience, a little bit about you, a little known fact that a lot of folks may not know about you.
Absolutely. So a couple of years, my son plays sports, and a couple of years ago, there was a football player on his team that had blood cancer and needed a bone marrow, someone that would be willing to donate plasma or bone marrow. And so I swabbed my cheek at an event that was held, and I kind of forgot about it. And there was probably hundreds of us that swabbed that day. And back in September, I got an email from Be The Match. And I honestly deleted it because I figured me and 100 other people got it. And why would I have been selected? It's all about me. And so I deleted it. And within a week, I had a certified letter at my front door, a text message, and a phone call. And I was like, I think they actually picked me. I think I got chosen. I've talked to my husband. And truly, I talked to my coordinator who helped me through the whole 2-month journey. And she said, I've been in the system for 8 years and her colleague had been in it for 20. And she said, it's truly considered winning the lottery when you get matched because it's not very common. And so I did. I talked to my husband and my family and decided to be away for a couple of days. And I don't get to meet my recipient for a year. But I do know that she is someone who's struggling with cancer and needed my plasma cells. And so 2 weeks ago, I flew out to Houston, Texas, and spent 7 hours doing a plasma cell donation, and she received it the next day. So I think about her often, and I'm trying to make a difference and get everybody, because I will say, and in that journey, I learned a lot about just so many different ethnic communities that are not involved in the system and not have swabs. So part of my spiel would be, if you are at all willing, they need, whether it be biracial, Asian, African-American, German, really any ethnicity outside of just a white American are in need of everyone to put their name in the Be The Match system. So if you're at all interested, you could go to BeTheMatch.com and just request a swab kit. It gets mailed to you. You swab your cheek and send it in, and then you just wait and hope that you can help save a life.
Well, there you go. We're going to have to bring you back on the program and do a deeper dive into that discussion as well, because that's equally as important as the conversation we're talking today. And I don't want to marginalize that by any means. So expect another invite to the show. So let's jump into the conversation today, really the impact of COVID-19 and on mental health. Again, it's undoubtedly had a profound effect on various aspects of our lives, including mental health, as the world continues to try to grapple with the challenges and the impact of that, whether it's you've lost loved ones, friends, family members, et cetera, due to the pandemic, or just your own challenges going through it as well. There's this wave of uncertainty and fear and anxiety affecting people of all ages and backgrounds and all walks of life. We are all dealing with it. I know personally, for example, my brother-in-law lost his battle with COVID. And so my sister's husband of 30 years is no longer here. And so she's going through a major life adjustment, as well as we all are, because of his loss as well too. And so it definitely has a very profound effect on everyone who's been experiencing, whether you had a loved one or a friend that was lost, or just your own personal journey through it as well. So I guess the first question I would ask you, Lindsay, is why is it important for us to acknowledge the impact of the pandemic on our mental health?
Yeah, absolutely. So people, they lost jobs, right? I mean, yes. I'm very fortunate. I remember my nanny called me on the day one and she's like, do I have a job? Like, all my friends have lost jobs. I'm like, sweetheart, I'm in telemedicine, I'm in mental health, like you're about to be working double time. So
Exactly.
my husband is a preventative care provider. He does pain management chiropractic. And so our lives turned, I say upside down, really right side up, right? Because like you said earlier, I do wake up every morning and my husband and I joke, like, what do we do if we win the lottery? And I'm like, I'm not doing anything. Like I love what I do because it is so impactful. And while we were very fortunate and lucky, we had family and friends around us, lost jobs.
Exactly.
You've got causes financial hardships,
Yeah.
some of it calls broken marriages. And for those that did lose loved ones, me as well, my biological father actually passed on Memorial Day of 2020 from COVID-19. And there was a lot of people that had family in nursing homes, had family in the hospital, had family pass away, couldn't attend funerals, couldn't see them. And so really, they just became depressed. I mean, churches closed down and you had nowhere to go.
Right.
Kids couldn't go to school. And so friendships were lost or that we're mental or social beings. And so to know that my child who needs interaction couldn't go to school and see his friends, I think everyone to some degree dealt with a little depression, and whether or not it was diagnosed and treated, we all got sad. And so I think that just being aware that it's real for everyone and ensuring that we have sources available, I think just like understanding, talking about youth and my passion for children, I think the youth took a huge hit during COVID.
I think so too. Absolutely.
And they were forced behind the screen. They didn't see their friends. And having a 12-year-old boy sitting still for 7 hours behind a computer was not working. So I think just like understanding and recognizing that mental health is here. It's not going anywhere. I would say I actually looked at a study recently the other day that I think it was in 2020, people that reported anxiety and depression was at about 40% based on a U.S. census.
Right.
And that was, I think, triple or quadruple from what it was prior to COVID-19. And I think looked at February of this year, it was still at about 30% of people that had some type of symptoms of anxiety and depression, and being kind human beings to everyone and being supportive and being a good friend. I think it's just critical right now.
No, absolutely. I completely agree. To your point, I know the CDC talked about the number of adults dealing with depression. It tripled during the pandemic as well. And then the Substance Abuse and Mental Health Services Administration also reported an increased number of folks who were abusing alcohol and drugs during this period of time. So that isolation and fear and uncertainty brought about all sorts of, unfortunately, poor behavior or impacted our behavior in a negative way. I know personally as well, I had a friend of mine whose son was a senior at a major university. He had done extremely well academically. He was an athlete. He was well liked on campus, a leader, and during COVID fell into a serious state of depression. And unfortunately, decided that he could no longer deal with it and took his own life. And so a 21-year-old young man who had his whole life ahead of him, his life has now been cut short, all because he made the decision, unfortunately, to take his life. And I know his parents tried a number of different things to support him, but it just unfortunately wasn't enough to keep him here. So this pandemic has had a tragic impact on all of our lives. And I'm so glad to talk to people like yourself who are in the industry and are starting to do some things to really address that. And so really recognizing this sense of urgency and addressing this issue, advocates like you and organizations that have been working really tirelessly to support and destigmatize this concept of mental illness, it's extremely important. So Lindsay, can you share some of your thoughts around the stigmatization of mental health within communities and any recommendations or suggestions on ways to start to enlighten people that mental health is not something to be embarrassed about or marginalized, but it is truly a real illness that we have to deal with?
Yeah, absolutely. I actually went to a suicide awareness, Out of Darkness was the name of a walk I did a couple weeks ago. And I remember thinking, okay, it's at Piedmont Park. It could be that big. There's probably going to be about 100 people. I was blown away. There were hundreds and thousands of people at this walk. So I just feel a little proud that okay, these are individuals who probably 5 years ago would have never been open to say that I struggle. I know someone who struggles. So I think that even something small as speech, right? Like my son needed speech when he was little. And I remember thinking like, I was so embarrassed that my child had a problem. And as I talked to other moms, I'm like, well, they've all done speech, right? And that's another
Exactly.
example, something that was affected during COVID-19 is my son who had been in speech for years, he was behind because there was no speech therapy happening
Sure.
and there was a mask. And so he couldn't see. And so kids struggled with things like speech therapy and therapy offices were closed. So they were struggling with something and the fix wasn't available because there were so many doctor's offices, psychiatrists, therapy offices that weren't open.
Exactly.
And I'll talk a little bit about kind of the fix for that and telemedicine, the part that it's played. But I think that there's a lot of cultural and religious stigmas with mental health.
Yes, there is.
Again, I feel very fortunate that I am a white American and I'm Southern Baptist, right? So we're all about, we've got problems and we've got solutions and we talk about it, but that's not the norm. I would say that there is a lot of Hispanic, African American cultures that mental health is not something to admit that you have a problem.
Or even understand in some cases. A lot of times it's not even not to admit it, but just to understand that it's an illness. It's something, it's not that Uncle Joe is just an alcoholic or is not quite right or whatever. But there is a disease here that has consequences to it, and we need to become more educated about it as well.
Yeah, that's a big piece of it is education. And how do we change that? How do we educate what's available? And I'd love to talk a little bit more eventually about just kind of what resources there are. But I think talking about it, and I do think we've made progress. Again, 5, 6, 7 years ago, I remember hearing through the grapevine that somebody was struggling with alcohol or substance abuse. And now I feel like there's lots of people I know, which is sad, but I'm at least happy to know that it's being talked about. And I have a friend of mine recently that I see for a beauty service, and she texted me and she's like, you know what? I just need a month off. I'm struggling. And I'm like, I texted her back. I'm like, I am so proud of you, because to say I have a problem and I need a break and I need friends and I need to not be at work thinking about it. I told her, I was like, listen, I'm here, but I'm proud of you. It's okay to struggle. It's okay.
That's right.
I have a problem and I need help. It's the first step. You hear it all the time in AA service. The first part is admitting you have a problem, and it's true, right? And I don't look at it as a problem. I look at it as I have something that I need help with.
Exactly.
It's not a problem. It's not an issue. There's nothing wrong with you.
Right.
Use the resources available to be a better person.
That's right. It's just like if you get a cold or a flu or a sinus infection or something, you don't sit there and just bear through it. You go to the doctor or you go to the pharmacist and you try to get something to treat the symptoms for that and hopefully accelerate the recovery of it as well too. And mental health is the same way. We need to recognize that I'm not feeling quite right. I feel off balance. I'm feeling a little down more so than normal. And are there things I need to be doing now to take that mental health day, a week or month or whatever the time frame is needed, and then seek the advice and counseling of professionals who can help me navigate that journey and give me those coping mechanisms and tools I might need to help improve my mental health. So you're absolutely correct. I think we have to erase the stigma behind it, recognize it's a normal part of life, just like catching a cold or a flu or anything else. And we need to think about it from that perspective as well and treat it as early as we can before it becomes progressively worse.
Yeah, I agree with that. And I think that fortunately, there's a lot that came out of COVID that was negative, but I do think there was some positive things as well that we've seen. For instance, there's more resources and availability, but even things like mental health days. Again, 10 years ago, I would have laughed at the thought of needing a mental health day. Now,
Right.
It's like, I actually need a day off to just breathe and spend time with my family, or I don't know.
Or with yourself, just a self-care day, right?
Just go get a massage or something. And so I do think that more organizations and employers are being more flexible on needing those mental health days, needing mental health services. Again, 10, 15 years ago, insurance didn't cover, at least not as much, mental health services. Now there's all kinds of employee insurance programs that are allowing for these 12 sessions a year for free that are paid for by the organization. So I think that we're getting there. I don't know that we'll ever go away, but I think we've made progress through COVID-19.
No, absolutely. Let's stay on that topic of services and solutions that are out there. You had mentioned employers are now offering other benefits around mental health services. Just share a little bit more from your perspective. What are some of the treatment options and services that an individual might be able to tap into if they recognize that there's a challenge with their own personal mental health or the mental health of loved ones and people that are in their life.
Absolutely. So it's interesting. I'm trying to be impactful in my personal life, my community, and then obviously with my organization I work for on a national level. But I just started researching a couple months ago on mental health resources in the area I live. And there was conferences you can go to for free as just a mom and talking about mental health in our schools. And I hate to keep harping on our youth, but there is just I saw people the other day wearing masks outside, and I know different people have views on. I remember thinking like, they're all wearing masks. And I'd asked a mom, I'm like, why are there so many people that are still wearing masks? And the response took my breath away. I was expecting, well, they're scared to get sick, but they're hiding behind the mask. From a social and a mental health perspective, they either are lonely or they're introvert. They don't have friends. And now they have the mask that they can wear. And I broke my heart. So I'm like, all right, how do I get involved in my community? And in one of these conferences I went to, I'd heard about this 988. And I was like, well, how has it been around? And I haven't, even heard of it. And I work in this industry. So that's probably the biggest resource out there is 988. You can call from your phone in the event that you are struggling. It's anonymous. It's not going to ring to a friend or your doctor. It's going to go to a 24/7 on-demand someone, whether it be a therapist or someone that's just trained to be able to help guide you in those situations. So understanding that's available. And then my son came home one day with, I guess, his ID card for school, and it was on the back card. I remember thinking like, that is so awesome that it is now in the faces of our youth because they're the ones struggling. I think that I heard something the other day about how youth are texting people with colored emojis, and those emoji colors are indicating how they feel that day.
Oh, interesting. Yeah.
And I was like,
realize that.
Like, I have a 12-year-old and what color is. And so I asked him about it. He was like, it's more of a girl thing than guy thing, but it's happening. And so I'd say that there's resources out there. You can search for the local United Way, could potentially have resources in the area. There's something else that's really boomed from COVID-19 that's been a positive is something called Community Mental Health Centers or SMHC, the Community Mental Health Centers and then FQHC. Those are federally qualified centers. And those weren't around, again, 5, 6, 7 years ago. Now you can search in your area to find ones that are, free or very little charge to people that need services that may not be able to afford it. Exactly. So I think looking for those resources in your area and making sure that they're there. There's also, we can talk a little bit more about how our organization helps larger health systems.
Yeah, I want to talk about that. And I just wanted to comment also, too, you brought something to light that I've got to be more sensitive to, and that's people who are wearing masks may not always be wearing masks simply because they're afraid of catching something. But this is a way of continuing to isolate themselves from people as well, too. So note to myself to be conscious of that, and hopefully those who are listening will do the same. But I do want to jump back into what you were talking about in terms of some of those services and the technologies, and in particular, what your organization also is doing to help folks who are dealing with mental health issues get the right services they need.
Absolutely. I will say probably maybe summer to fall of 2020, I got asked to speak on a panel of larger systems in the Atlanta metro area. And they were larger healthcare organizations that had been planning for some type of telemedicine service.
Right.
And COVID hit, it like a switch flipped on, and it was like, all right, we need it, and we don't need it a year from now. We need it right now. And how can you help? And so my organization, it's Integrated Psychiatric Consultants based out of Kansas City. And that's exactly what we do. So we do offer some on-site, but majority of what we do is telemedicine. So we partner with large healthcare organizations. For those of you in Atlanta, the WellStars, the Northsides, big organizations like that can also be as small as a rural hospital. We partner with correctional facilities, so prisons, school systems. I've been communicating with a children's hospital, and part of a project that they're working on is partnering with these rural school systems that children maybe that school system can't afford an on-site therapist at every school. And these children who are needing services more so in rural areas than the suburban areas don't have a therapist, or maybe there's only one offered once every 2 weeks.
Exactly.
So what they're looking to do is partner with an organization like ours that can provide this teleservice that offers more availability for children. In this example, the option to have some type of therapy service. So we partner with, it could be community mental health centers, the FQHCs, outpatient facilities, PHP, IOP programs, which are outpatient programs partnered with the hospitals to help transition someone from in a hospital setting to being able to function back in their normal life through these different programs. And so we partner with them to offer teleservices. And so whether it be Monday through Friday, 8 to 5 or 24/7 on demand for more of the ER settings, it allows a provider to provide those services, let's say in Florida, and maybe that patient's in California. And as long as they've got a license, the other example would be during natural disasters. In the last couple of years, we've had unfortunately, one hurricane after another, one ice storm after another.
Exactly.
And when hospitals don't have power and they don't have a telemedicine program in place, these patients potentially that need mental health services are not getting that medication management and stuff. So telemedicine, I really think it's here to stay. And now you're seeing there's dozens of different services, whether it be radiology and psychiatry and different available offerings. There's something else that happened during COVID, which was telemedicine services to patients in their own home. So these patients would be able to, they couldn't drive, whether it be for weather or any type of disabilities or didn't have a car.
Right.
Were able to pull up a cell phone and be able to see their provider in real time. And I just think it's amazing. So going back to this availability and stigma of healthcare, having more options to me is really helping that stigma leave, which is you've got services whenever you need them by the use of telemedicine.
No, that's great. And I know personally as well, as when we identify my son's having some challenges of battling depression, and we sought out counseling services, the majority of his counseling sessions were done through behavioral health consults as well too. So he did them in the comfort of his home. He could go in his room, close the door, have those conversations privately as well without anyone else involved, and get that on-demand, real-time counseling that he needed, both scheduled and on-demand as he needed it as well, too. So I'm a firm believer in that as well. And then in another life, I served as a CIO for a behavioral health organization in St. Louis, and we deployed mobile devices to first responders as well, too, because a lot of times first responders are encountering people who are going through mental health crises and they're not always sure how to handle those situations. So whether it's an EMT or a policeman or a fireman or someone that's dealing with a loved one or a neighbor, they're not trained in many cases to know how to de-escalate that issue with that mental health person or even evaluate the person to determine, do they need other specialized care as well? So technology is really becoming very instrumental to providing access to those professionals. And to your point, you could be a counselor sitting in Atlanta, Georgia, and providing services literally across the globe to individuals as well, which is very powerful, especially when you get to your point earlier outside of communities that don't have these professionals in them. So you get into rural America, and you've got a soldier coming back from a campaign and dealing with post-traumatic stress, but yet there's no counseling services in his local community. He or she can still get the help they need through these types of platforms as well, too.
Yeah, there was a prior life. I had a contract with a hospital that was on an island outside of Alaska. And I remember a patient there at that hospital we contracted with needed a mental health provider.
Right.
And was a child, and they didn't even have a pediatrician. And the only way to get to the mainland was boat or plane. And I'm just to think how impactful what I'm doing is just having, I think sometimes people think, oh, I'm not a provider, I can't help. Well, I'm not either. But part of what I do every day is just making that connection to a facility that can provide care for patients. They don't have a pediatrician on the island. So to give them some type of mental health to prevent, save a life via phone. And you hear oftentimes, well, I don't get the same service than I would in person. What I have found in the last 8 years I've been doing telepsychiatry is that these rural healthcare systems that have outpatient facilities that they would have an appointment in the middle of nowhere, Idaho, they don't want to go to a therapist who they're going to run into at the grocery store. They don't want to. So having tele allows people that, again, because of
anonymity as well, too.
That's exactly right. It's anonymous. They don't have to know the person on the other side. And that way they really open up and they can get the better care that they need as well.
No, absolutely. And at the end of the day, it's better to have some care than no care at all as well, too. So yeah, it may not always be perfect, but the absence of it could be detrimental to individuals as well. To continuing down that line of conversation, as we think about the social determinants of health and social determinants of mental health, lack of access to facilities, technology, et cetera, what are some of the things that you're seeing as it relates to, or just quality care, depending on your background, ethnicity, whatever it might be? Just your comments on where we are in the U.S. as it relates to equitable access to mental health services. We do have a long way to go. Are we right on track? Just your general thoughts around that.
Yeah, and that kind of ties back into what we've talked about earlier is culture and religious backgrounds. I think based on where different people are located and in communities where there is still that stigma and you don't want to talk about the fact that you have a problem. I think part of it is, one, we got to overcome the stigma in every background, every religious denomination, and understand that that person, no matter what their background is, needs help. Do I think that the quality is there? Yes. I think once we can overcome that, I do think that because of things like telemedicine, someone who maybe can't afford, are living out of their car or don't have a vehicle and can't get this because they can't get there. Well, that's not fair. And so having telemedicine options, looking at resources in your community that might be free, and that would help be diverse towards people that maybe can't afford it. During COVID, people lost jobs. They lost their insurance.
Exactly.
Oftentimes they can't afford the care that they need. And most every psychiatrist or therapist you go to now, most of them will even say, I don't even accept insurance, or you can file it yourself, but I don't file it.
Right.
Well, what if they get home, they don't have internet? They don't have money. They don't have internet to file it on their own, or don't, maybe not even understand how. I mean, you can imagine dealing with insurance companies isn't always the easiest. And so I think that having more access and availability to all, my mantra is, I want to ensure that every person across America, no matter the zip code they live in, has access to, the behavioral health care that they need. And there's a lot of communities outside of, we're familiar with Atlanta. I mean, I could drive a mile down the road and hit 15 therapy offices where someone in rural Georgia doesn't have that option. They may have to drive an hour. So really, biggest solution is having some type of telemedicine option. So I think once we can get more communities to be open to having those resources, when you go to your primary care doctor, sometimes people don't even know that their primary care doctor has a referral with a telemedicine option. So being open with your care provider, whether it's your OBGYN or your PCP, and saying, hey, I'm struggling and I need to know how I can get help. And so do you have a resource where some people, especially men, they don't want to talk about it, or their wives are in there. And so you ask how the appointment went. And it's like, I don't know. I wasn't in there. So I think just being able to say, I have something that I need help with. The biggest thing and kind of my takeaway here is have a person, have a mentor, someone that will have your back, that will hold you accountable.
Sure.
I mean, everyone needs a person, whether it's 1 or 5, have someone that you can go to that will not judge you, that you can be open with, to say, I'm struggling. I'm at the lowest of low and I need help. I need someone to talk to. Being kind seems like such a basic thing to say, but it's not happening.
There's a world of difference,
right? It makes a huge difference, right? Yep. So yeah, I think that I think we're close, but I still think that people have really just got to be open with their care providers when they see them to try to get some type of referral to a behavioral health partner.
No, absolutely. Absolutely. So AI and machine learning and these emerging technologies and the thought of how they're going to impact healthcare in some form or fashion is the topic of debate today. Give me your thoughts on the application of AI and machine learning and using it as a tool to support the delivery of behavioral health services.
Yeah. So with telemedicine as the example, I think having a care provider, and we'll just use a hospital setting, they have to go from one patient's room to the next, and they might get distracted with, I don't know, someone brought cake to the office. And so they get distracted, where in telemedicine, you really are back to back to back. You really can see more patients in a shorter amount of time. one of the things that I learned recently in going into a hospital is some of these hospitals are now looking at using the TVs in the patient's rooms instead of having to spend $40,000 on a cart with a telemedicine monitor, that they're looking integrating telemedicine via the screens, which again, that saves, because what does happen with telemedicine, their struggles is that the provider will be waiting to see the patient and the cart's sitting in a closet or a bathroom and it's not the patient room, right? So that help get patients seen quicker. But as I mentioned earlier, it's in mental health, but there's surgeries being performed right now with robots. And I went to the Georgia HIMSS conference recently, and I saw this little robot driving around delivering food, right? It was just an example. And I'm like, it is absolutely amazing to see what AI and technology have done to be able to increase access to all different specialties, not just behavioral health, to patients across the globe. I mean, it's truly mind-blowing.
No, absolutely. And to your point around technologies like robotics, as we start to deal with the tsunami of individuals who are now moving into their senior years every day. 10,000 people are turning 65, and we'll see that trend happen for the next 25 plus years. And by 2050, 1/4 of the world's population will be over 65. And so when you start getting up, in those senior years, there's always this issue around isolation and loneliness, obviously monitoring the person's condition, both physically and mentally. Having these, for example, robotic technologies in place could be this kind of digital nurse or digital companion as well, too, that can continue to communicate, monitor, and react to an individual's condition such that they don't harm themselves, or the proper notification is made to healthcare professionals who can then intercede and hopefully support that person before their situation deteriorates. So I'm excited about the possibility of AI, machine learning, robotics, wearable devices, and all these other technologies that are coming out that can help us hopefully manage our health, both physical health and mental health as well.
Yeah. And I think that also too, when COVID hit, it happened literally overnight. And the struggle is there's not enough providers. Yes. And so while people got sick overnight, you can't go to medical school overnight. And so now, as a nation, as probably really a globe, we are struggling with having enough nurse practitioners, with psychiatrists, with therapists, because you can't go to school as quickly as people are needing the mental health from COVID-19 pandemic. If you have any interest in being able to be impactful, consider going to some type of schooling to help provide services. Now, again, going back to AI, there's so many different programs that are now offered virtually that people can complete with a full-time job and do the schooling in the evenings because of COVID. Now there's these virtual programs, which is helping to increase the amount of providers as quickly as we can get them through school. So that's something else, again, that has positively been impacted by COVID, is there's more accessibility to educational programs for those who are wanting to go to school and contribute back to the community.
No, wonderful, wonderful. Well, as I suspected, our time is nearing the end as well, too. And Lindsay, thank you so much for all the insights that you've offered on today's show. I'm going to ask a very open-ended question now, and feel free to respond wherever the first thought that pops in your head takes you. What strikes you as being really relevant or important that we haven't talked about yet today on the show, or that you would want to reiterate to our listeners as they try to come to terms and navigate this new norm around mental health post-COVID?
So to wrap up where I started, which is my story is I'm a mom. I've got 2 kids. One is in middle school, and we're talking prime years for the onset of mental health struggles. So my biggest advice is be involved in your kids' lives, know what they're talking about, know what's going on, ask open-ended questions. I mean, my son knows I go through his phone every night. And it's not because I don't trust him. It's because there's things that might be being talked about or discussed that he's not mature enough to be able to respond to. The biggest example, you and I, and people probably even listening to this episode, we are fortunate in that we care and we want to know and we're involved. And there's a lot of people out there that aren't hearing this message that we need to communicate to. And I do think that so much of it is being impacted by our youth. The biggest suicide, unfortunately, the biggest group of people that are committing suicide is adolescents.
Yeah, our young folks. Exactly.
And they are the future of everything. So I think that it's important to be involved, know what they're doing, teach them how to respond, like how to look for signs and symptoms of friends who might be struggling, the importance of not bullying, just being nice people. So I think that making sure that your kids, it's not just because I said so and no, but
right.
The answer is no, and here's why. And I'm going to give you tools to be success. Watch what's in writing, watch what you're screenshotting, check your kids' social media if they have it, making sure that they're being kind human beings. And sometimes they're just too immature to know the impact of what they say and do on other people.
Absolutely. Absolutely. And I would also say that sometimes we as adults always appreciate and understand the impact of what our words have on individuals as well. So I would suggest that we all take that advice, no matter where we are in our life's journey. Well, thank you so much, Lindsay. Senior Vice President, Lindsay Demboski, Senior Vice President of Business Development for Integrated Psychiatric Consultants, for sharing your thoughts and insights on the best ways to navigate our new norm post-COVID, understanding the impact of and recognizing the impact of mental health on our lives and our communities, but also informing people that there are services that they can tap into and leverage. And I'm just excited also as a person in technology on how technology is also starting to be a tool and a resource for healthcare professionals to start to attack this issue, this illness, but also we as consumers and patients being able to use these tools on our own as well too, to seek the help that we need as well. So thank you so much for joining the program, and we're going to have you back, and we're going to talk about things like your experience in donating your bone. Was it your bone marrow or your blood?
Plasma cells. Plasma blood.
Plasma cells, your cells as well too. So that's a whole other topic of conversation that I'm very interested in learning more about as well too. So thank you so much for joining us. You're very welcome. And that wraps it up. Another episode of Straight Outta Health IT is in the bag. I just want to thank my listeners for continuing to support the program. And as always, your feedback and commentary is always welcome. Let's make this episode go viral. It's an important topic for discussion. So let's shout all your friends and colleagues and associates out on how great of a program this is and this wonderful guest that we've had today. So thank you, everyone, for the show, for your support of the show. See you next time. Take care, and God bless.
Thank you so much for listening to Straight Outta Health IT. We hope you enjoyed today's guest. For more unfiltered dialogue of healthcare leaders and influencers, be sure to tune in next week. For the show notes, transcripts, and resources, please visit Apple Podcasts, Spotify, or your favorite streaming platform. We invite you to give us feedback by reaching out to Christopher Cunny on LinkedIn, just searching for Straight Outta Health IT, and you'll find us. We are constantly having live discussions about diverse topics in the industry.